Lots coming up to squeeze in the last 35 minutes of the program. I want to cross now to Terry Barnes, former health advisor to the Howard government, joins me live from Melbourne. Terry, thanks for joining us again. We learned that private health insurance premiums are about to go up again, double the rate of inflation. Of course, inflation is low, but it always, comparatively, always getting more and more expensive.
Because what those premiums reflect are the cost of providing the services that they buy, and that includes doctors, includes hospitals, it includes your dental and optical, and it also includes things like medical devices and prostheses that they stick into you when they operate, say to replace your knee or to put a stent in your heart. So yeah, costs are continuing to go up well above the rate of general inflation, and health cost inflation tends to be about 6 to 7% a year, and it's in line with that. But if you're a punter paying those premiums, you're not going to like it very much. End of story.
Yeah, and there's all sorts of problems, right? Because people drop out of private health insurance. That puts more strain on the public system, or people feel that they're cheated of that choice. So everybody has a stake in it, whether they have private health insurance or not. What are the latest pressures on the cost increases? There has been a focus on what the government was trying to do with those medical devices that you mentioned, the sorts of things that are implanted and the like?
Well, the government did a deal with the medical devices industry to effectively revise down the whole price list to make it more affordable to insurers as the payers, and therefore to consumers who pay the premiums. What the insurance industry is saying is that because of creativity on the part of the industry, your manufacturers and wholesalers, they're managing to ensure that doctors order the, if you like, the Rolls Royce instead of the Kingswood in terms of fitness for purpose, or to, do little sweetheart deals to ensure that they maximise their returns while the insurer pays for them. And the insurers are sick and tired of that, as the president of the Health Insurance Association said in a speech yesterday. So, but it's not just that. I think it's the fact that younger and healthier people still need to be convinced that they need private health insurance, that the risk of going to hospital is actually real, not something that's way down the track when they're old and sick. And the government has made some really good steps in relation to that to make it more financially attractive to young and healthy people, but it's not enough, some are saying. But I actually think that the real problem with private health, Chris, is what the funds don't pay for, and that is the excess greedy out-of-pockets that some doctors and specialists charge.
Yeah, you're really good on this stuff, Terry, and it makes a lot of sense, because I think this is the frustration. People make the sacrifice of paying the insurance premiums. They want to look after their own health care. They want to have choice in their health care provision. And yet when they use it, they get stiffed by these additional charges. And they figure that apart from your Medicare levy, your insurance premiums, and then the additional charges, you feel like you're getting hit from every direction.
Well, I think that's absolutely right. And, somebody had a baby last year. I got hit with out-of-pockets. But on the other hand, I thought they were reasonable out-of-pockets compared to the outstanding service from our obstetrician that we got. But in other cases, and we've seen some of those publicised in the media in recent months, and we don't need to mention names, there are really egregious bills, in terms of Medicare rebate maybe in the hundreds, but the actual doctor fee is in the thousands, and the health insurers are not obliged to pay that, and they generally don't. But look, I think the other side of it, though, is that if the health insurance industry is saying that particular players in the game are rorting it, whether it be on the prosthesis side or on the doctor charging side, then perhaps it's time for the Australian Consumer and Competition Commission to actually have a formal look into this and actually have an independent investigation and clarify this once and for all, so consumers get a better deal.
Well, that makes sense. I mean, the problem here is, you can make a lot of money as a GP, right? You work pretty hard, but GPs make a lot of money. You go to the next step to specialists, and essentially, if they're millionaires, they're turning over an enormous amount of money, and why? Because they can. Yeah. What's the problem here? Is it the way the industry is controlled by those colleges and the like, where they effectively limit the supply of specialist services, so it's the closed shop? In other words, is the answer just to have more doctors, more specialists, and open them up to more genuine competition?
Well, I think supply and demand is an issue, actually, Chris, and certainly the specialist colleges have a big say in that, but also the government does in terms of the training places, the specialist training places that it funds. So I think the government can actually put the maximum pressure on colleges by funding more training places, full stop. But, you know, if you go to a specialist rooms complex and you go to the car park and you see some of the fancy cars that are going around, there's obviously plenty of money in it. And a lot of those specialists will say, well, look, I've done my basic GP training, or medical training, I've done my hospital residencies, I've done my specialist training, I've put in 20 years of my life, I'm entitled to get a reasonable return, and nobody's questioning that. I think the issue for me is...
We all agree on reasonable return. It's a matter of, is your reasonable return a nice Merc or some sort of McLaren?
Well, that's the point I was making, that there is reasonable return and there's unreasonable return. And I think I think that reasonable out-of-pockets patients should actually be prepared to fork out a little bit if they want good, top-quality care. But when we're talking about, a gap of thousands, if not, certainly hundreds, but in many cases thousands of dollars, I think there is a problem here. And I think the government has an opportunity, having been re-elected, having done some major reform to private health insurance before the last election, in terms of how it's covered and the way it's subsidised, they've got an opportunity, I think, to actually take on the AMA, take on the specialist colleges and take on those greedy doctors who are actually destroying the value of private health, not just private health insurance, but the whole private health choice by their greedy behaviour. Yeah, good point, Terry. Thanks for joining us. Pleasure. Terry Barnes there, who always talks a lot of sense on these health issues. We'll try and get the Health Minister, Gregor Hunt, on sometime in the next few weeks to talk about these issues, find out what the government's plan is to try and keep these costs down in the private sector in particular.